My father was a physician. He was a plastic surgeon. He actually did his plastic surgery training in Akron, Ohio. My dad had come here from Beirut, Lebanon during the Civil War. So he had been a general surgeon during the war. For a physician who came from a war-torn country to land in America and all of a sudden learn plastic surgery, which, I think most of us forget, plastic surgery was born out of reconstruction. World War I exposed men to trench warfare, and that meant that their hands and their faces were being shot and had devastating injuries. So plastic surgery, which had in some infancy been around, really developed out of the experience of war. And my father, upon graduating his training, moved to New York City. He ended up doing what was called a microsurgery fellowship at the time. He was the first one. He did an aesthetic fellowship after that, and then he joined a man named Thomas Rees. Thomas Rees was really the grandfather of cosmetic surgery as we know it. And Dr. Rees reminded us, number one, there's nothing wrong with looking good to feel good. Number two, there's nothing wrong with restoring what age has taken away. As I got older, maybe at 5 or 6 years old, my father, he would bring me to work in the mornings. Wake up at 5 in the morning, drive to the hospital, sit in the back of the operating room, don't touch anything. And that experience did two things. Number one, it demystified what I do. The thing about what I do, which is maybe different than other doctors, is I'm really focused on why my patients are special, why I'm not so special. I take the responsibility and the privilege of being a physician, and particularly a surgeon, very, very, very deeply. So my father, his famous saying to me was, the only surgery that matters is the one you're about to do. If he had 50 rhinoplasties in a month, which is a lot of surgery, he would remind me that 50 opportunities to be perfect or other. Working with your hands to me makes me feel at peace with myself. And I tend to be much more like my father's style of medicine. I want to maybe restore what was lost with time, with childbirth, with pregnancy, with weight loss. What I typically frown on is taking enhancement to exaggeration. My goal is to make you happy that you're you, and not that we help you look more like someone on a screen. I became a plastic surgeon really because I like happiness, meeting with my patients, allowing them to leave my office even before the operation, feeling better than they did walking in. And I like to make people smile. And this is the field of medicine. It's about smiles, not tears.